just a couple of disclosures. I have three different jobs, and so there's inherently no conflict of interest with the topic I'm presenting. But just to keep in mind, I'm both a clinician and researcher at the Mind. I'm a program director of a PhD program at Alliant, and I also work in my private practice doing assessments for the regional center. And the presentation will take all my last 20 years of working with the wonderful neurodiverse community. So my goals for today is to just present three different social skills supports program, two of them that I'm involved with at the Mind, and then talking about personal boundaries, healthy relationships in the neurodiverse community, and then of course the cultural sensitive issues and transition support, which is the overarching topic of ECHO. So first talking about the challenges, then presenting the social skills program and access, and then more specifically about health, safety, relationships, and the other topics at the end. And I'm sure you're all aware, you work with these wonderful individuals. You might be a neurodiverse individual yourself. But in general, social development, social thinking is a very complex task in our developmental process. And unfortunately, it's largely experimental. And most of these are implicit knowledges that you have kind of built in, and it's very hard to explain how to make it explicit. And some of this experimental might not fall into very clear categories. So having a clear communication for neurotypicals with neurodiverse individuals can sometimes be perceived as abrasive. Like, why do I have to complain this? So communication challenges. Then missing social cues, because as you know, communication is both the nonverbal and verbal part. And especially integration of the nonverbal with language can be a challenge. Then we see it in the teenager, adolescence age, that single incident experiences, social media, pornography, provides a framework that has nothing to do with real world settings. And trying to apply these lessons in a real world setting might also have some legal complications or completely make relationships not possible. Sensory differences, cleanliness standards, physical intimacy can be also different. How if sensory overload leads to excessive stimming, a potential partner may not be able to deal with that, or not able to understand if they don't know the reason for it. And then physical and emotional boundaries for both the neurodiverse individual and the neurotypical individual in a relationship, and then challenges with perspective taking. So this, just as the ahead, all these issues we deal with. And this is from this 2010 paper that I had so many times, this conversation of individuals talking about relationships and then falling in exactly the same things. I had no real idea of how other people think, what they might think about me. So being told wash and smell clean for the sake of others meant nothing to me. So this perspective taking. Then how to communicate physical intimacy with this assumptions. Oh, if I have a boyfriend, I need to have sex with that person. So all this framework. And then this last point, the only person I'm going to hug is my mom. I just don't know when it's okay to touch other women. All this communication challenges and the complexity of social interaction are caught in these examples really well. So what is out there? How can we help, or how can we support to reframe thinking? Of course, the peers program, UCLA, the historically longest on the market, 16 weeks program working on social skills, friendships, dating. The Hearts program, which I'm going to talk a little bit later, is specifically for healthy relationships, 6 sessions for online. And then the idea how to find out if a program makes sense, if they call it a social skills group, do they celebrate neurodiversity, or do they try to teach something to make a neurodiverse individual fit in a framework? So I had several parents that came from different social skills programs that were perceived as being hurtful. So in the 2 programs I'm involved in at the Mind, we celebrate neurodiversity. We try to do role plays, visual aids, social stories, peer modeling. The one program I want to talk about, it's called the Social Skills Program. And it was originally a postdoctoral fellowship in 2001 and has become a clinical program. And we have served over 100 children and their parents. We're vendorized by the regional center, and also has provided training opportunities for all these wonderful colleagues. Then in 2014, Marjorie Solomon, who was also the postdoc that did the social skills program, was trying to find something that works for adults, neurodiverse adults, because it is really hard to find programs for neurodiverse adults. So the Access program was a research grant, 2014. They ran a cohort in 2016, had a publication. And then in 2018, I took it over as a clinical program at the Mind. It's a 20-session hybrid program. We offer sessions both in person and for online participation, starting at the end of June until beginning of November. So just this week, we had our 6th cohort graduating. And annual reunions in May. We're vendorized by the regional center as of this year, and so far had about 60 neurodiverse individuals and their social partners in that program. Both the social skills and Access, we celebrate neurodiversity. We would like to help provide opportunities for socialization, for connection, for networking, conversation, improving self-esteem, decreasing isolation, and teaching those skills that could be valuable in the college work life, help with independent living supports, and to translate these skills, have the life practice outside the group. And the overarching theory is CBT, cognitive behavior therapy, try to change thinking. And to give you an idea how this social skills program looks like, we have this table with the group topics for the teen and tweens. We started 8 years all the way to 17. And then have a parent workshop that provides additional psychoeducation approaches and problem solving for these individuals. So for the social skills program, working on social circles, conversation skills, thinking traps, and then friendships, and how to do the social filters and perspective taking. I always like to show this little meme, special needs parent fell in the hole, to really make sure the parents are so happy to find other parents that are in the same boat and then connect and find support with other parents. To give you a visual for the Access program, I know it's a very busy slide, but I tried to put on one slide as much information as possible for the Access. So Access stands for Acquiring Career, Coping, Executive Control, and Social Skills. So trying to get to these 20 sessions filled with, again, the foundational concepts of social circles, then talking about coping skills, relaxation techniques, identifying thinking traps, and giving them tools So on the right-hand side, you see the toolbox to get to a reframing of getting overwhelmed, how to approach instead of avoid, small steps tool, weigh the evidence, having the positive, the pros and cons lists. And then for the building relationships building block, we talk about what are the different levels of friendship, disclosure about diagnosis or communicating accommodations, basics of communication, what are the different levels, and then personal boundaries and assertiveness. For the last part, work-related matters, it is highly individual. So we work on a resume and then trying to identify career options, what could help to find something that fills their heart and hopefully also provides an income. So just two examples from participants from the last couple of years. I have one that was really, really interested in animals. And now she has a dog grooming business after going through Access. Also one individual that is now a professional house and pet sitter and makes a great income with that. Of just the previous cohort, we have a wonderful individual that studies physics and is now a TA with the skills that he got from our Access program. And for the first time was telling us, oh, now I know what the students mean when they ask me that and that question. So he had the ability to help with communication and being able to just ask a little bit more if something is not clear and to give him the self-confidence to do that and empowerment. The other program I would like to talk about is pretty recently published, an online program just for relationships. And I thought it might be useful for you to see how the Hearts program is structured. So at the beginning, they talk about what is a healthy relationship, how to identify abusive behaviors, what are warning signs of unhealthy relationships, then how to get to that approach, launching a new relationship. What does it mean to be a trustworthy friend? How to develop curiosity in other people? Is there this motivation to reach out to other people? And what I found in the many individuals I worked with in the beginning, when they said, I'm not interested in other people, it sounds to me like a trauma response. It's so many years of frustration of trying to connect to another individual and not getting the success. But then if we can help understanding and with the tools, at the end of the 20 sessions of Access, even the ones that said, I never want to do anything with people, now instead of participating online, came in person and really appreciated being in person and connecting to another person. Then neural health for relationships, so getting into the fight, flight, freeze, sympathetic nervous system response, relationship anxiety, why is self-care and relaxation very important for relationships, and this put your own oxygen mask on first before you put it on your fellow other being. The next 3 sessions, so it's just a 6-session program, meeting new people, just some skills, how to approach that, perspective taking, what are healthy boundaries, setting boundaries, and then the last topic, how to end relationships. What are these red flags? What are concrete advice on how to get help if an abusive relationship is identified? Why it can be so hard to end a relationship, and what are the best steps to approach that complex topic? This is an example from an Access slide from the friendship continuum, how we try to approach this. And we have both role-playing examples, acquaintance, casual friend, close friend, and then also the complexities of intimacy in the close friend. And we have some in-access case examples that we discuss with the individuals. What would be something they would do in that situation? And then they bring examples from their own life so we can troubleshoot with them and give advice on how to take a relationship a level further or to move it in the other direction. So you see that the blue arrow in the middle goes into both directions. A couple words about safety. Here again, the social circles tool came in handy, and how to communicate the boundaries. This army green visualization are the different examples for the types of boundaries. So material, physical, mental, and emotional boundaries. It helps to label. And in a conversation of what are my boundaries, what are your boundaries, what are steps in behavior to take that you go on when somebody pushes or breaks your boundaries. And this question of people taking advantage of you, how to identify a false friend that asks for money, asks for services, but then when you need help, never shows up, and how to communicate that. Consent, a next big topic that we address in the communication building block. And I'm sure by now you've seen this video with the teacup. This, for some of the wonderful individuals I've worked with, was really interpreted in a more literal sense. So it was hard to then generalize to the actual sexual connotation with the consent. And we had to redo the teacup consent video with the actual terms. This is what it means. That there's no quid pro quo, no trading. You have to be able to give consent. It's freely chosen, no threatening behavior, no pressure, no blackmail. And then, of course, giving a definition of what all these words mean. And then consent in general, it's not just about sex, it's about, is it okay to give you a hug? Is it okay if I take this? Just asking and waiting for a positive response from the other person to then proceed. As simple as that. Relationships in general, trying to identify and communicate what are healthy, what are unhealthy relationships, how to choose a partner, and the ability to identify that as a two-way street. Both parties should be supportive, kind, respectful. What is controlling? What is abusive behavior? Not just in romantic relationships, also friendships. This behavior can be modeled for children. And if in media, movies, books, problematic relationships are displayed, point those out, give those as examples, and have an open and honest discussion about these types. And again, it all boils down to communication. How to communicate interest in a respectful way, how to give and obtain consent, how to communicate desires, discomfort, boundary setting again. What am I comfortable with, what I'm not comfortable with? Sexual safety, STIs, condom use, very literal, very clear descriptions. I know some of these topics are really uncomfortable to listen to, but the things that I experience is the more clear you're able to address those and communicate those, the clearer you are with your communication, the better you are understood. And then whom can you ask for help? How can you clarify things? Is there someone other that you can trust? A helping professional, a therapist, a social worker, a speech and language pathologist. And it's a hard conversation, but very important to have. And then the active listening part, not just the, okay, let's have a conversation, the back and forth of a conversation, but the active listening part. I'm listening to you with my whole body, with my whole heart, and I'm with you while you tell me these hard things. I put this little image up there in the right corner about the perspective taking. Try to put yourself into the shoes of the individual you talk to. If it's a child, adolescent, an adult, put yourself into the shoes of this person having this conversation. How's the language level? If you have an individual that communicates in a more simplistic language, can you use visual help? Can you reach out to a speech and language pathologist to help break down complex information into easier to be understood language? Another example from Access, I had a wonderful individual with mostly single word communication style. And a co-leader, Rachel Raitsky at that point, she was a speech and language pathologist, and she helped me tremendously break down those complex slides that I shared with you into information that can be much easier understood and digested. And that was for me a big eye-opener of how to be able to communicate complex things and break it down into more tangible processes. Regarding relationships, this comes up with teens a lot. How to explain flirting. Relationship making, flirting has the most unwritten rules of just about any social interaction. It's super hard to identify when, where, how to recognize if somebody flirts with you. And then all these different terms for dating, hooking up. What does that mean? What does it mean? What do you know what anyone wants when they ask, oh, let's hook up? What does this person mean when they say that? What do I understand when they say that? And again, coming to how to end a relationship, not wanting to hurt the other person's feeling, but also experiencing this is unhealthy. I'm getting so stressed by this. How can I cope with? How can I communicate that? And then talking about the gender spectrum. How do same-sex relationship work? How can we approach these things? And I'm sure you're familiar, in the last couple of years, there's been a lot of research that neurodiverse individuals more commonly identify with gender fluidity or LGBTQ plus categories. So for these, how do we communicate relationships with that? How can we help them with connecting to that community? How not to get afraid of stigma and everything involved in that. Then talking about, of course, different abilities and getting to the disclosure question, how to disclose about social norms, work-related things. And as a reminder, there are different levels of disclosure with no background given, with some specific terms given, to the actual diagnosis to get these supports. And I thought it might be helpful to see social disclosure examples, because that is relevant for relationship and relationship communication. So, for example, I have difficulty understanding emotions, especially facial expressions. What would help me if you could use emotion words to tell me how you're feeling? The feelings wheel would be a nice visual tool for that too. Sometimes I get stuck on my own topic and don't notice that people have lost interest. Could you please be direct with me? Etc. And a couple more examples for that too. And getting to the end of my presentation regarding the cultural considerations. All these influences in social norms, cultural competent care, adapting to fit a cultural context, and the cultural adaptations to different gender, race, ethnicity, women and girls on the spectrum, still very much underdiagnosed, diagnostic issues, etc. And then how can we help with independence through social skills training? I gave you a couple examples from the Access, setting goals, career planning, helping with problem-solving skills, and then workplace readiness, how to get these unwritten workplace norms communicated, how to reach out, where to get them, punctuality, work ethic, and then getting to disclosure, self-advocacy, and a couple of employment success stories I shared from the Access program, and then the life skills for the independent living. The regional center has great options for that support, and managing finances, household tasks, tenancy rights, all this. How can we break it down easier? How can we communicate this? And then supporting community engagement, and providing visual aids and support tools to help with challenges in these behaviors. So I have a ton of resources from the background of the relationships, some recommendations, the paper I shared, of course, talking about camouflaging, nonverbal communication, double empathy problem, the wonderful resources from Spark for Autism. They have very specific sex education, autism LGBTQ identity, and then the paper for the HEARTS curriculum, and I think that was shared in the chat as well. All right, thank you so much.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.